we are into the enzyme substrate complex. In the present, we have the enzyme plus product. Substrate is going to get switched. Okay, but in this thing, it has been proposed as three theories. Three theories have been proposed. In these three theories, they have explained the different type of enzyme and the substrate type of reaction. Enzyme and substrate type of reaction. Three theories were proposed in order to clear the concept of enzyme and substrate complex. Okay, the models of binding of substrate enzymes. Models of binding of substrate to enzyme. Models of binding of substrate to enzyme. There were three theories have been proposed. Three theories have been proposed for explaining us to understand the concept of enzyme and the substrate binding. There are three theories they have been proposed. Three different theories. Okay. The first model in this they have been said that first model is the lock and key model. Lock and key model. Okay. Lock and key model. There are two things they have been said. And out of that, they have been said that the first model is the lock and key model. Now, Key's theory was proposed by scientist Fisher in the year 1890. In the year 1890, he proposed the theory of the lock and the key model. Now, it is the first model to explain the enzyme reaction. It is the first model to explain the enzyme reaction. देखिए एंजाइम और सबस्ट्रेट की जो बाइंडिंग है उसको समझने के लिए तीन डिफरेंट थ्योरीज दी गई। एंजाइम और सबस्ट्रेट कॉम्प्लेक्स को समझने के लिए रिएक्शन की पूरे कैसा करके उसके थ्री डिफरेंट थ्योरीज दे हैव बीन सेड टू अस, दे हैव गिवन टू अस। इन दैट थ्री थ्योरी द फर्स्ट थ्योरी इज द लॉक एंड की मॉडल थ्योरी। लॉक एंड की मॉडल थ्योरी. Now, this theory was proposed by the Fisher in the year 1890. In the year 1890, he has discovered how the enzymes and the reaction will work. And it was the first theory to explain us. The पहली theory इसके basis पे आप explain करें कि enzyme और substrate कैसे react करते हैं. How the enzyme and substrate will go into react. Okay. Now, in this theory, the active site. You know that what you mean by the active site. Active site, this is the we said that the active site is rigid and pre-shaped. Rigid and pre-shaped. That means that active site, what this theory is saying, the active site will be rigid, tough in this nature, and it is a pre-shape. That means that they are not going to shape the shape of the active site. Okay? That means that what is the active site? It is pre-shape. Pre-shape, what is the pre-shape? पहले से बना हुआ. Now it is not going to change its shape. अब enzyme अगर substrate अगर आ भी जाएगा तो it's not going to change its shape. Like the word itself is representing that lock and a key model. Whatever the keys are there, it will going to fix on a specific lock. Not all the keys will going to open all the locks. Specific key, specific lock. In the same way, the lock is a pre-shape. Pre-shape, you have fixed the shape. You have fixed the shape of the lock. The key will going to get fixed in that only the specific key. In the same way, it is saying that the active site, the first study of the enzyme that it was happened in the year 1890, they have said that the active site is so rigid in the pre-shape, only the specific type of substrate will come and go into bind. It was the first theory which was proposed by the Fisher, and he was saying that the active site will be rigid and the pre-shape. Now, Now these active site will allow to bind the specific substrate only. Specific substrate only. These active site only bind the specific substrate only. That means that the pre-shape of this pre-shape with the help of the diagram, if the now the substrate, the enzyme is a prefixed and it is a substrate specific. The substrate should be in this form that should fit in the enzyme and this is the enzyme and the substrate. So the substrate which has been formed is a specific है. Okay. But these model does not say about the allosteric regulation or inhibition of enzyme. While we are teaching to you the inhibition of the enzyme and the allosteric enzyme, I have said to you that there are certain allosteric products are there, regulator or inhibitor, which will going to come and bind to the enzyme other than the active site. जब हम आपको allosteric enzyme पढ़वा रहे थे, allosteric inhibition पढ़वा रहे थे, at that time I have said to you that allosteric inhibition or a regulator or other irreversible inhibitor, at that time we have been said that there are certain other products are also available which is going to bind the enzyme other than the active site. And this will going to either regulate or inhibit the enzymatic activity. While we are teaching to the allosteric inhibition, I have said to you. But these model, when the first discovery has been happened with the scientist named Fisher in the year 1890, he has given a theory that specific model of the enzyme will going to fit and work on the specific substrate. First theory was given to us. But this theory has been failed us to set more thing about the enzyme, like allosteric enzyme, where other than the active site, the other substances will come and bind. They will either regulate or inhibit. ठीक है? So it was the first theory which was. मैं क्या बोलना चाह रहा हूँ? What I am trying to say कि enzyme में यहाँ पे pre-shape रहता है और specific जोड़ता है. लेकिन जब अपन allosteric enzyme पढ़े पिछले टाइम पे allosteric inhibition, वो टाइम पे बोले कि अपन allosteric inhibitor ऐसे inhibitor है, आप इसी में डायग्राम allosteric inhibitor ऐसे टाइप के inhibitor है which will going to bind the enzyme other than the active site. ये active site है तो वो allosteric inhibitor यहाँ के bind करता है. तो ये जो theory है lock and key model की, ये अपने को ऐसा तो बता रही है enzyme and substrate complex, but it is fair us to show the allosteric regulation of the enzyme. ठीक है? For that thing, second type of theory has came in the existence, that is called as a induced fit theory. Induced fit theory. A second type of theory has came in the existence, that induced fit theory. The first theory has been said that the active site is rigid and pre-shaped. पहला जब डिस्कवर करा हमने बोला कि एक्टिव साइट इज रिजिड है भाई और प्री-शेप्ड है. In the second theory, we will see how this going to. At first theory, it is also fail us to say about the allosteric regulation of the enzyme. Allosteric regulation of the enzyme. Now, these model is also called as hand in glove model. Hand in glove model. Now, this theory was proposed by Daniel Oshland in the year 1958. In the 1958. 1958. Daniel. ठीक है. Now, the concept for this theory it is the The active side of this theory has said that it is not rigid and the pre-shape, but it is a flexible. The active side is not rigid and pre-shape, it is flexible. It is flexible. And it is also said that shape of active side can be modified by the binding of the substrate. Can be modified by the binding of substrate. Pehli theory mein what you have said, the shape is pre-fixed, you can't change it. Now the second theory they have said that no, there are certain enzymatic reaction is happening where the enzyme, the active side of the enzyme is flexible. Even though the shape of the substrate it is not similar to the enzyme, but the substrate it is having the tendency to change the active site structure of the enzyme. A diagrammatic theory. For an example, enzyme shape is in this format and the substrate in this structure. ये सही भी एंजाइम सबस्ट्रेट ऐसे नहीं दिखते, ये आपको समझ में आने के लिए बताया गया। Now for an example, this is the enzyme, this is the substrate. Now you can clearly see that enzyme it is not having the active site similar to the substrate. That means that this enzyme, the substrate cannot be fit in this enzyme. But this theory is saying that the substrate it is having the tendency, specific substrate it is having the tendency that they can change the active site of the enzyme. They can change the active site of the enzyme. This theory has been said. That means that after that changes, the active site has got to change and the substrate will go into fix and the enzymatic reaction is going to get carried out. पहली theory, the first time अपन theory पढ़े, इसके अंदर theory में they have suggested that no, there is a enzyme and the substrate complex. It is like a lock and key model. How the lock is going to get open to the specific key. In the same way, the enzyme is going to get react on a specific substrate only if they are going to have a similar structure. But second theory has been said that no, it is the enzyme will react with the specific substrate, but the structure of the active site can be modified with the substrate. पहली थ्योरी में अपन पढ़े एंजाइम जब भी रिएक्ट करता जब उसका सूटेबल स्ट्रक्चर का सबस्ट्रेट रहता। सेकंड थ्योरी अपने को क्या बता रही, एंजाइम सबस्ट्रेट स्पेसिफिक है बट स्ट्रक्चर कैन बी चेंज। देखिए फर्स्ट टाइम में आप जब देखिए तो एंजाइम और स्ट्रक्चर ऐसा रहना दोनों भी फिट हो जाना। सेकंड टाइप के मॉडल में आप इन्हें ये बोला कि एंजाइम नहीं रहा तो भी active site if it is not in the form of same like substrate, even though the substrate can induce the changes and the modification in the enzyme. And this theory has said as the action of the allosteric enzyme, allosteric modulators, allosteric inhibitors. ये theory के जरिए हमें मालूम हुआ कि that enzyme can also burn in the structural changes with the help of the substrate. नहीं समझ में लगा? आई समझ में? It was very easy now. Now the third theory it is a substrate strain theory. Third theory is the substrate strain theory. substrate strain theory. Now, we are straining the substrate, or else we are modifying the substrate so that it can fit into the model of enzyme. यहाँ पे देखिए आप सबस्ट्रेट क्या कर रहा था, एक्टिव साइट को चेंज कर रहा था. यहाँ पे सबस्ट्रेट क्या कर रहा था, एक्टिव साइट को चेंज कर रहा था एंजाइम. अब यहाँ पे एंजाइम क्या कर रहा, सबस्ट्रेट को मॉडिफाई कर रहा. यहाँ पे फर्स्ट उसमें अपन बोले, here we have been said that the substrate it is modifying the active site of enzyme. But in this theory, substrate strain theory, it is saying that not only the substrate is going to modify, but sometimes the enzyme it is having the tendency to modify the substrate. That's the reason you are saying this theory as a substrate strain theory. That means it is training the substrate so that it can fix into the active site of enzyme. Those meaning strain, not straight. Substrate strain. Okay. So I can write down the point that substrate is strained due to induced conformation change in enzyme. Now if you are going to see the structure of the enzyme, now this enzyme is in this format. Now the active site you can say that it is slightly present in the form of U shape. इसी बात को समझने के लिए जबकि आपका सबस्ट्रेट का अगर स्ट्रक्चर अगर आप देखें तो इस फॉर्म ऑफ स्क्वायर आइसोट्रिक. Now what this substrate strain theory is saying to us, now this enzyme will work on the substrate, or else this enzyme will strain and induce the structure of the substrate so that the structure of the substrate can be changed and it can fit into the model of ठीक है. तो पहली थ्योरी क्या थी, लॉकेट की मॉडल. ठीक है. व्हाट इज इन द लॉकेट टू डिस्कवर दिस प्रेशर इन आइडिया 1890 to the first reaction in order to say that to understand the concept of the enzyme and the substrate complex. But he has said that the active site is so rigid and T-shaped, only the specific type of substrate can bind to the specific type of reaction. The reaction can carry on. And the second thing, induced fit theory, it has been in the postulate in the year 1985. It is like a hand in glove theory. क्यों ऐसा बोला गया hand in glove? जब आप first time gloves पहनेंगे, the first time if you are wearing the while you are inserting the hand into the gloves will not going to exactly fit. You need to adjust the glove. Glove आप एक ही तरह में करके निकालना था हाथ में. ठीक है. Rubber glove if you are going to wear, it is not going to fit at one time. You need to adjust the glove. In the same way, when the substrate it is there, it is adjusting with the enzyme. That's the reason they have given the name hand in a glove model. Because आप एक ही टाइप का glove नहीं आता. You need to adjust it. In the same way, is here how you can adjust. If the glove is flexible, then only you can adjust. If it is a rigid and pre-shaped, you think that you are not going to fix. Might be your hand will vary from my hand. Okay. So here it is the second concept he has given that the active site is flexible and it can change with the help of a substrate. If the substrate come and going to get the presence of the active site, due to the substrate, the enzyme active site can change. And these type of induced fit theory, it is giving the concept of the allostatic reaction, where the other product other than the active site, the other products are coming and binding and regulating the enzymatic activity by the stencil and changing in the enzyme. Third theory, it is a substrate state theory. Now, this induced fit theory and the substrate state theory, it is very similar. If you are going to see here, both the theories, they are saying that the active site is flexible. It can change accordingly, or else the enzyme is having the tendency to that it can change the substrate so that it can fit into the model. Okay? Now the induced fit theory is saying that the active site is very flexible. It can fit the substrate, can having the structural conformation can be changed, and the substrate can be fixed into the enzyme. Now in the third theory, substrate state theory, substrate straight theory, that we just straight in the substrate. Here the structural conformation was there at active site. Okay, substrate has been changed. Now the changes is not taking place in the enzyme. The changes is taking place in the substrate. Okay. Now you will be able to find that the substrate has been changed according to the active site. So three theories they have been proposed. Right now we are dealing with the few theories, that is the induced fit theory and the substrate state theory, because it will give us the clear concept of the human enzymology, where the allostatic regulation and allostatic inhibition will be going to get carried out, and the specific information we have been given that how the enzyme and the substrate will be going to get reacted. Okay, three models and three theories are very basic. Now we will be dealing with the diagnostic importance of enzyme. Diagnostic importance of enzyme. Importance of enzyme. Diagnostic importance of enzyme. What is the diagnostic importance of enzyme? The first thing we will be going to see is the digestive enzyme. Digestive enzyme. The enzyme which we are going to present in the digestive system and we are going to promote the digestion will be called as the digestive enzyme. In that, the two major enzymes will be acting as a diagnostic role. It is the amylase. Amylase. Second thing is the lipase. Amylase and the lipase. Amylase is also going to present in the digestive juices, which is going to present in the pancreas. It is also present in the salivary glands. In the saliva also we will be able to find amylase. Okay. Now, what is the role of this amylase? Whenever in the previous classes we have been said that whenever the enzymatic activity is going to get increased, the velocity is also going to get increased. It will give us a clear concept in order to diagnose diseases. Previous classes में वो इस बात है. ठीक है. Now, if the concentration of the amylase is going to get increased inside your body, it is going to bring with the I think that they might be suffering with the acute pancreatitis. Or else in some cases it is also seen in cases of mouse. Acute pancreatitis or a mouse. If somebody is suffering from the severe type of pain, severe unbearable pain, and we have been seen that it is not related to the appendicitis, then they might be suffering from the pancreatitis. Severe type of pain, acute onset pain. अगर किसी को पेट में दर्द हो रहा, तो अगर आप देखें मैकबर्नस पॉइंट पे, मैकबर्नस पॉइंट मालूम आपको, where the appendix going to get like appendix का दर्द नहीं है अगर समझ लिया, ठीक है? तो then you need to go for this amylase test. If somebody is having severe type of unbearable, थोड़ा मोटा पेट के दर्द नहीं होता है, वो ज़्यादा होता है, unbearable रहता है, वो दर्द होता है. So if somebody is having the higher level of the amylase, then they might be having the acute pancreatitis. Sometimes it is related to the mumps, which is a viral infection. Okay. Now, lipid is also going to give you the clarity of the acute pancreatitis. But apart from the acute pancreatitis, if we are going to see the elevation levels, very elevated levels of the lipase, then also they are giving you the information regarding the carcinoma of pancreatitis, of pancreas. Amylase और lipase same type के enzyme है, both they are going to present as a digestive enzyme, both they are going to present in the pancreas. But amylase will give you the acute pancreatitis, whereas if the elevated level of the lipase, if you are going to see, it is not only the thing which is going to get, so you are going to get elevated in the acute pancreatitis, but it is also going to increase in the carcinoma of pancreas. इसके लिए आपको elevation होगा lipase देखने होगा. आपको कुछ पूछना है? ठीक है. Now, second type of enzyme, I have already said to you this thing, the transaminase. Transaminase. Now, the transaminase, the most common it is the ALT. ALT also known as SGPT. LTPT ऐसा करके याद रखिए. ठीक है. Transaminase. These are the transaminase type of enzyme. Now ALT, the other enzyme, the enzyme which is going to present in the AST. What is this AST also called as? SGOT. SGOT or SGOT. Now this SGPT is a very specific marker which is both the enzyme is going to get present in the liver. दोनों की enzymes liver में present रहते हैं, SGOT और SGPT. But SGOT it is not only going to present in the liver but it is also going to present in the heart. SGOT एक ऐसा enzyme है कि किसमें रहता? liver में भी रहता और किसमें रहता? heart में रहता. That means that these elevation can indicate both the diseases. It may be related to the heart or it may be related to the liver, isn't it? Okay. Now, what is the key diagnosis for this? SGPT. It is only specified thing. It is going to get increase in cases of liver diseases, whether it may be hepatitis, whether it may be cirrhosis, okay, whether it may be jaundice. Any kind of diseases which is related to the liver, it is going to get increased. The elevation of the ALT. अगर कोई पेशेंट में आप देख रहे कि ALT और SGPT अगर बढ़ा हुआ है तो वो क्या मार्क कर रहा? लिवर डिजीज. लिवर डिजीज कैन बी एनीथिंग. इट इज अ कार्सिनोमा ऑफ लिवर टू, और इट मे बी अ सिरोसिस, और इट मे बी अ फैटी लिवर, और इट कैन बी अ हेपेटाइटिस. ठीक है. ना इन केसेस ऑफ द AST, अगर आप LFT का पैरामीटर देखें एंड यू हैव सीन द ओनली SGOT is getting increased, then it is related to the MI, myocardial infarctions. हार्ट अटैक को अपन मायोकार्डियल इंफ्रैक्शन भी बोलते हैं. हार्ट अटैक को अपन मायोकार्डियल इंफ्रैक्शन भी बोलते हैं. हाँ, कार्डियक अरेस्ट को लोग ऐसा आता है. कार्डियक को हार्ट बोलते हैं, अरेस्ट को अटैक ऐसा डायल्यूशन. ठीक है. Only the SGOT is going to get increased when it is related to the myocardial infarctions. That is heart attack. But if it is related with the SGPT, then it is representing in the liver disease. अगर SGPT के साथ बढ़ रहा हो, along with the SGPT, then it is related to the liver diseases. So there are two types of transaminases are there. Both are present in the liver, but SGOT is also present in the heart. तो अभी कैसा मालूम करेंगे हार्ट की वजह से एलिवेशन हुआ या फिर लिवर की वजह से एलिवेशन हुआ? Then you need to check with the SGPT. If the SGOT levels are rising up with the SGPT, then it is a key diagnosis part. It is related to the liver. Only SGOT is getting increased and it is related to the cardiac issue, most in cases of myocardial infarction. ठीक हो गया बात? Now, third type of enzyme, it is a diagnostic enzyme, it is a phosphatase. phosphatases. Now the phosphatases जब कभी भी बात आती है, we going to have the phosphate which is abundantly present inside your body. It is the ALP, alkaline phosphatase. Now when the alkaline phosphatase is going to get increased, कब alkaline phosphatase increase होता? When the alkaline phosphatase is going to bone disease. If only the alkaline phosphatases are going to get increased inside your body, then it is related to the bone diseases. If it is increasing along with the SGPT, then it is related to the liver diseases. And sometimes pregnancy में भी देखिए alkaline phosphatase usually slightly increasing. There is no need to worry about that. There will be the slightly elevation of the ALP in cases of the pregnancy. Slightly elevation, not moderate or significant. Moderate to significant. Only the slightly increase will be seen in cases of the pregnancy. Now, the bone diseases, if only the ALP is increasing with a moderate or significant increase, it is going to get seen in cases of the bone diseases. The most common the bone diseases is the patient or at the disease. Sometimes carcinoma of the bone is also responsible for increasing the pain. Sometimes carcinoma of bone. Okay? Now, in the same way, alkaline phosphatases, most of the people they don't know that there is also a phosphate which is present inside the body, which is called as the acid phosphatases. Acid phosphatases. Now, these acid phosphatases generally we are going to get not having a minimum activity inside your body, we are going to have only minimal activity. But these acid phosphatases they are going to get increased in cases of prostatic cancers. The key diagnosis for the prostatic cancers. Prostate gland. इसके लिए कंफर्मेटरी और कौन सा टेस्ट करवाते हैं? Which is a non-enzymatic test for the confirmation of prostatic cancer. जो एंजाइम नहीं है, लेकिन अगर आप देखिए एसिड फॉस्फेटेसेस बढ़ गया हुआ है दिस पेशेंट, वी हैव सीन दैट there was an elevation in the acid phosphatases level. What are the other confirmatory tests to confirm that it is related to the prostate cancer? And it is a non-enzymatic test. It is a prostate specific antigen PSA. Prostate specific antigen. Prostate specific antigen is a test which is used to rule out the carcinoma of prostate gland. अगर आप acid phosphatase test करवाए and you have seen that elevation of the acid phosphatase level, the other confirmatory non-enzymatic test, फिर से एक बार बोल रहा हूँ, PSA it is not the enzyme. PSA एंजाइम लिंक है. ACP आप कराए उसके अंदर देखिए elevation level देखिए and you have seen the prostatic cancer, might be prostatic cancer. The other confirmatory test is the PSA, prostate specific antigen. Prostate specific antigen, it is a test which is used to rule out the prostate cancer. If you have seen the elevation of acid phosphatases, the other confirmatory test is the prostate specific. Now the other enzyme, it is the enzyme of carbohydrate metabolism. Enzyme of carbohydrate metabolism. Enzyme of carbohydrate metabolism. Enzyme of carbohydrate. Enzyme of carbohydrate metabolism. Enzyme of carbohydrate metabolism. You know the first enzyme, it is the aldolase. Now it is an enzyme which is responsible. If the elevation of these enzymes is going to get seen, it is going to give the representation of muscular dystrophy. Muscular dystrophy. if the aldolysis enzyme अगर आपकी बॉडी में इंक्रीज हो गया, then you will able to see the muscular dystrophy. Muscular dystrophy means loss of muscle mass. Loss of muscle mass, muscular dystrophy, weakening of your muscle, muscular dystrophy. Okay? Now, it is also going to get seen increase in the MI and leukemia. What do you mean by the leukemia?
Blood cancer.
Okay. Now, the second enzyme which is going to get present in the enzyme of the carbohydrate reaction is the LDH, lactate dehydrogenases. Very important. Lactate dehydrogenases. Lactate dehydrogenases, very specific type of enzyme. Very important. This elevation is going to get seen in cases of MI, myocardial infarction, as well as in cases of pernicious anemia. Pernicious anemia किसको बोलेंगे? किसको बोलेंगे? Pernicious anemia. हाँ? परेशान नहीं है. Knowledge से नहीं. Pernicious anemia అంటే ఏంటి? Deficiency of vitamin B12. Deficiency of vitamin B12 type of anemia is going to see in cases of pernicious anemia. मालूम होना चाहिए आपको. ठीक है? Now there are certain miscellaneous enzyme. It is not related to some system. कोई सिस्टम में कॉल नहीं होता और miscellaneous से important. First thing is the CPK, creatinine phosphokinase. Again, is a very important enzyme in order to detect the MI, myocardial infarction. कल हम पढ़ाएंगे आपको इंशाअल्लाह के myocardial infarctions में कौन से enzymes कितने टाइम के लिए elevation होते हैं. What are the enzymes are there and what is the time period for the elevation and the reason from there to come down. ठीक है. CPK, creatinine phosphokinase is the myocardial infarction. और ये बहुत अच्छा की पॉइंट है. इट इज अर्ली डिटेक्शन ऑफ MI. सबसे पहला एंजाइम जो मायोकार्डियल इंफ्रैक्शन में एलिवेशन पे दिखता है. द फर्स्ट एंजाइम यू विल एबल टू सी द एलिवेटेड लेवल इन केसेस ऑफ द मायोकार्डियल इंफ्रैक्शन. किसी को हार्ट अटैक हुआ, सबसे पहला एंजाइम जो एलिवेशन पे आता है इट इज द क्रिएटिनिन फॉस्फोकाइनेज. लेटर ऑन LDH, लेटर ऑन HCl. इट विल कम फॉर अ शॉर्टर पीरियड ऑफ टाइम. वो जल्दी एलिवेटेड होता, फिर जल्दी डाउन भी हो जाता. ठीक है, एलिवेशन भी जल्दी होता. हाँ, if somebody is having the higher level of the CPK, it is representing that just now you got that. Time period matter करता है, what's damage happening. So you have been taken the test and in that you have been seen that CPK levels are very high. That means that it is very the initial stage of the habit. Just now the habit has due to which the elevation of CPK. So the elevation levels of the CPK, it is acting as an earlier detection of the MI. पहला enzyme which will go up in the elevation, it is a CPK, creatinine phosphokinase. ठीक है? Now there are other enzymes also there. Gamma glutamate peptidase. Gamma glutamate peptidase. Transpeptidase. Now I have said to you that gamma glutamate peptidase is responsible for detecting the alcoholism, as well as is going to get seen in cases of elevation in cases of the liver diseases. ठीक है. गामा ग्लूटामेट ट्रांसपेप्टिडेज. gamma glutamyl transpeptidase. Gamma glutamyl transpeptidase किस चीज के लिए रहता है बेटा? It is a key diagnostic marker for the alcoholism as well as liver disease. Okay, so there are certain diagnostic importance of enzymes and what is going to get happen when they are going to get elevated. They have to see. Our detailed lecture is there how the myocardial fraction is going to get work and what are the isoenzymes and the specific nature of action. Tomorrow we will be able to. Thank you.